Welcome to the Success MRCP channel. Cardiology MCQ number 4. A young man presents has a long-standing history of the attacks of a wheeze in the lungs, flushing, and loose motions off and on. There is no other significant history. Examination of the CVS shows prominent precordial pulsations. His routine tests are done. He has increased urinary excretion of 5-hydroxyindoleacetic acid in his urine. Which of the following is your top differential? 1. Congenital tricuspid regurgitation. 2. Carcinoid heart disease. 3. Aortic regurgitation. 4. Pulmonary regurgitation. 5. Mitral regurgitation. Answer. 2. Carcinoid heart disease. Update. Carcinoid syndrome refers to a group of symptoms caused by the systemic release of different kinds of humoral factors like polypeptides, biogenic amines, and prostaglandins, mostly from well-differentiated neuroendocrine tumors. Previously well-differentiated neuroendocrine tumors were known as carcinoid tumors. Neuroendocrine tumors are derived from enterochromaffin cells that are ubiquitous in our body. It is reported that only about 10% of neuroendocrine tumors result into carcinoid syndrome. Carcinoid syndrome is most commonly caused by neuroendocrine tumors of midgut that metastasize to the liver. Neuroendocrine tumors of foregut and hindgut can also rarely cause carcinoid syndrome. Neuroendocrine tumors mostly arise in the gastrointestinal (GI) tract, about 70%, followed by respiratory tract, about 25%. 2. Neuroendocrine tumors can rarely arise from other areas like ovaries, testicles, and kidneys. The cluster of symptoms suggestive of systemic disease with a predominant heart complication, because it is a cardiology question, and that the patient has prominent precordial pulsations suggesting right heart disease. Carcinoid heart disease occurs if there is accumulation of fibrous tissue in the heart, especially to the undersurface of the tricuspid valve. Carcinoid heart disease can hold the tricuspid valve in a semi-closed position, so tricuspid stenosis and regurgitation can occur. Pulmonary regurgitation. A stenosis occurs if carcinoid heart disease affects the pulmonary valve. Right-sided heart valves are implicated because, in most cases, the primary carcinoid tumor is in the bowel and with liver metastases. The latter release serotonin and kallikrein that travel through liver sinusoids and empty into the central vein of each lobule. The central veins coalesce into hepatic veins, which leave the liver and drain into the inferior vena cava and right side of the heart. Increased levels of serotonin and kallikrein create systemic symptoms such as bronchospasm, diarrhea and flushing, which are part of the carcinoid syndrome.